Project 14. Infiltrating a wound with local anesthetic before suturing. You will need the venipuncture trainer, a pair of clean gloves, a 5 milliliter syringe, a 20 gauge needle, a clean work surface cover, the IV fluid bag, alcohol hand rub. Method 1. Follow these steps. Remember the basics. Take a medical history, prepare your hands hygienically, and don clean gloves. Withdraw some of the fluid from one of the IV fluid bags from the outport. This will be used as a fake local anesthetic solution. Draw a 5 centimeter or 2-inch line on the venipuncture trainer, representing the laceration. Insert the needle into the tissue about 5 millimeters or 1/4 of an inch away from the laceration, next to the beginning or end of the laceration. Deposit a drop or two of local anesthetic and wait for 30 to 40 seconds. Advance the needle parallel to the long axis of the laceration to the end of the laceration, or to the length of the needle. Inject the local anesthetic solution continuously just below the skin as you withdraw the needle. Note the skin rising as you deposit the local anesthetic fluid. With a real patient, you will see blanching. In other words, the tissue will become whiter. If the laceration is longer than the needle, repeat the same procedure along the next section of skin next to the laceration, but ensure that you enter the skin in already locally anesthetized skin. Repeat the same procedure on the other side of the laceration. Wait 2 to 3 minutes. Test the effectiveness of the local anesthetic by poking the wound area with a sharp probe or by pinching it with a forceps. You are now ready to prepare the wound for suturing. Method 2. The materials and items required to do this project are not supplied in the kit. For this method, one uses a thin 27 gauge needle. A dental syringe and needle will work just fine. Penetrate the laceration through the raw edge of the wound. Starting at one side of the laceration, advance the needle into the adjacent tissue for about 1 centimeter or 3/8 of an inch at an angle of about 30 to 45 degrees. Repeat the same process of injecting local anesthetic solution through the raw edge of the wound every plus or minus 7 millimeters, or every 1/4 of an inch, on both sides of the wound. Wait 2 to 3 minutes and start the suturing procedure.